My name is Dustin Bump. I am the Regional Director for the Ayer Neuroscience Institute for our Hartford region. So I did my fellowship in 2014. So I've been with the organization for a little over 11 years now. So I went to the George Washington University. I never really stepped foot in Connecticut prior to the fellowship and really wasn't very familiar with Hartford HealthCare and Hartford Hospital. My fellowship was with Hartford Hospital specifically, but I really worked very closely with the neuroscience team in developing really the Ayer Neuroscience Institute. So it was kind of the foundational year of that. So it was a great experience working with neurosciences, but also the hospital leadership team. I was able to be involved in several hospital specific initiatives and projects as well. The projects at Hartford HealthCare are very rewarding. The one that I think was most unexpected was early in that fellowship year we had the Ebola outbreak in Africa, and so there was a lot of concern about our preparedness for that. So I was asked to be a part of that task force. We developed an isolation room, did a lot of training across the system, and actually ran drills across the system as well. The other project was our headache program. So we were very early in the development of an official neuroscience institute at that time. We did not have a headache program, so I was able to be involved really from the ground up, developing a business plan for creating a headache center. I was actively involved in all of the discussions with the headache physician recruit, and we have now developed really a foundational program for neurosciences with our headache program that now stretches across the state. I think the preceptor is really a key piece of the fellowship, and that's one of the things that really drew me to Hartford Hospital and Hartford HealthCare. My preceptor was Wendy Elberth, who is now the Senior Vice President for the Ayer Neuroscience Institute. But Wendy had several years of fellowship preceptor experience. I had the opportunity to speak with prior fellows and the current fellow at the time and understand a little bit more about how that relationship was. And it was really exactly what I was looking for in a fellowship. The ability to have frequent touch points with the preceptor, but also have some, again, autonomy to take ownership of a project and really have that trust from your preceptor to lead that. I've been fortunate, still working with neurosciences. My office is literally just down the hall from Wendy, so I'm still learning from Wendy every day. So it's really cool to be a part of that. And I think as the evolution of the fellowship continues, there's more and more preceptors across the system. And so, we're always still connected and helping and lessons learned from our fellowship experiences as well. So I think that just continues to help, evolve and improve the program, which is great. Well, I would say 100% go for it. I think the fellowship is really invaluable. The experience you get, the relationships that you start to develop early on. You certainly have access, to meetings and things that you would not in other entry-level roles, I think. And so just getting that experience and that opportunity to prove yourself and to show what you can bring to the table, I think it really helps to launch your career in a different way. Even if you don't stay with the organization, like I met my wife here as well, actually, and we've really established roots here in Connecticut. So in addition to an educational opportunity, it's you're really you have the opportunity to kind of set yourself up for a future career here, as well as being a member of the community, which is very exciting.